Hey everybody, Dr. Brace here for Facial Plastics Friday. I'm back from vacation. We did a facelift yesterday with CO2 laser resurfacing, followed by a brow lift and a blepharoplasty. And today we had busy clinics and consults and follow-ups. And I'm just getting to this video now. So what I want to talk about today is that we often have visitors in our clinic. Now, sometimes I run an interdisciplinary clinic with Dr. Katie Sawa from Cambridge, and so we see facial paralysis patients together, and we'll be operating together next week with an interdisciplinary approach to help somebody regain kind of facial movement or facial balance after they've had Bell's palsy or surgery where they've lost the function of their facial nerve. I also get a lot of residents that come either for core rotations or for electives. And so with McMaster, I have an adjunct position there, and all of the fourth year head and neck surgery residents come and rotate with me. And last year, the senior plastic surgery residents also come and do cosmetic cases with me and to learn, rhinoplasty, face and neck lift, blepharoplasty, brow lifts, all that sort of thing. So if you come to see me, don't be alarmed if there's another person in the room. These are doctors who are well trained, and they're at the end of their training usually, and they're just brushing up their knowledge on facial cosmetic and facial reconstructive procedures, because to be honest, in the university setting, it's not a procedure or a set of procedures that you get a lot of exposure to, because there's so many other things going on. And so we do get residents from McMaster primarily, but also from University of Toronto and from Western, and sometimes from across Canada. For the month of September, we're going to have Dr. Creamy with us from the University of Toronto, and she was with us last year for an elective. She's spending the whole month this year, and so you'll see her face around starting Tuesday of next week. I also sometimes have visiting colleagues, and that's a fun thing in facial plastic surgery, that we're very open and collegial about how we do things and why we do things. And so sometimes I go and visit colleagues to learn from them, and sometimes we have colleagues come to visit me to learn from me. So I have had a number of different colleagues over the past year come and visit. Most recently, we had Dr. Katani come. We had a great day together talking about noses and rhinoplasty. And that's normal here too. Part of the reason why we have so many visitors is because I have a practice focused on facial plastic and reconstructive surgery. And that's kind of rare in Canada to have it kind of focused, dedicated that way. And so we do have a high volume of procedures that people want to learn better, want to see a different approach to, want to get more exposure to. So all that to say, there's a lot going on behind the scenes. When you come to see me, don't worry, you have my full attention, but there may be other eyes and ears in the room. Of course, if I am operating on you, I'm doing your surgery, but I am teaching at the same time. And there are residents in the room who are learning how to do that procedure. So don't be alarmed if you see another face. I'm going to leave you all for a long weekend before the school year starts next week. Everybody have a happy long weekend, happy Facial Plastics Friday, and we'll see you next week.